Hello everyone, infection prevention and control by Group G. Yes, firstly we have surgical hand washing. This is by Nurse Shura. First of all, you wet your hands from top to bottom and then you apply soap like she's doing. Then you rub your hands, rub the soap fully from top then to elbow, rub fully. Then you go on to rub palm to palm, then right palm over left dorsum with interlaced fingers, and then vice versa. Palm to palm with fingers interlaced, back of the fingers to opposing palms with fingers interlocked. Then rotational rubbing of the left thumb, clasping of the right palm, and then vice versa. Rotational rubbing backwards and forwards, then rubbing the knuckles. Then you go on to rubbing the tips of the fingers. Then after making sure you have cleaned everywhere, you rinse thoroughly like she's doing to remove the soap. Then you go on to dry the hands. Use one towel to dry one hand, then the other to dry the other hand like she's doing. Then you go on to dispose them off in a dirty linen container. Next we have surgical gloving by Nurse Vicky. You check your pack, check the size, check the expiry date, check for any openings. If there is none, then you proceed to open by tearing down and then drop on a sterile and clean cloth, like she's doing. Then after that you proceed to perform your hand hygiene, then come back. Now this is the sterile part, so you open to expose the left and right arm like you have seen. Then you start with the dominant arm and pick up the glove for the dominant hand by touching the inside of the cuff of the glove. Using the other hand, remember not to touch the outside of the glove. Then pull it over, without touching the inside. Then after that, use that hand, insert it in the cuff of the remaining glove and pull it over the non-dominant hand, and then insert it very well and adjust the gloves as necessary and as required. Then after you interlock and keep your fingers and hands away from your gown and above your shoulder, above your elbows. We have damp dusting next. This is by Nurse Tina. So you talk to the patient, tell them what you're going to do. You proceed to pull everything away from the wall. You check around, are there any spillings, are there any electronics? You check the curtains, make sure there is no dust. Then you bring your equipment close. First, perform the hand hygiene thoroughly, making sure every part is cleaned. Then after, proceed to don into your clean gloves as she is doing. Remember that when you decide to clean, use the rule from cleanness to dirty ends, so to avoid and minimize the spread of microorganisms, and that is minimizing the spread of infections as well. So even when you're cleaning the cupboards or those cabins from the further end, the tables from the further end to the nearest end, from top to bottom. If it is mopping, from the farthest end to the door. So you wet and dip your cloth or your towel or whatever you're using to clean in soapy and clean water. Then you do the strokes as I have told you, from the farthest end to the nearest end. Remember, this other end, there are very many chances and high chances of a nurse knocking on it and spreading infections from somewhere else, or even the patient. So that's why you do the strokes, one stroke or one-sided strokes, not going back and forth. So you go top to bottom, top to bottom, top to bottom as she's doing. You make sure you talk to the patient as you're doing all this. We do not want them to feel scared or anything. Then you proceed. After you are done with everything, make sure of maximum cleanness. Push back the things to the wall, the beds to the wall, everything, and clean everything that is required. So after you remove the gloves and dispose them off in a black bin. So now you talk to the patient, put back everything the way you found it, make sure they are comfortable, and thank them, wish them a good day. Voila. Next, we have preparing and organizing a sterile pack by Nurse Nighty. So these are our instruments from drying. So now we get them all, we prepare our surface very well. So we start to organize them very well on this surface. That's the cloth. We had a cloth first that is going to seal the pack, and that's the other inner cloth. So now you start putting your things. She's using a Cheeto forceps because she does not want to make these things that have been cleaned dirty. Remember, we are minimizing the spread of infection. So we had a drape, a towel. Now she has put a cleaning dish, different types of forceps as she's going to use them, or as they're going to be used in the procedure the pack is being prepared for. So we have pieces of gauze, we have gallipots, as you can see. Now you make sure you organize these things very well so that your pack is sealed completely. So after you are done, you start folding your pack. So now we have, when you're folding, you start from the farthest end to the end near you. So you fold inside out. She has folded the farthest, now the one inside. So you make sure the pack is secure. You fold then the sides. You fold like that. You make sure you make a neat pack like Nurse Nighty is doing. So you fold again the farthest end from you, then the one nearest to you. Then you seal up your pack very well like she is doing. Make sure you make a neat pack, because we do not want the person going to use throwing these instruments, because we do not want to contaminate them. Secure your pack very well with gauze straps like she has done. Put the pack in the drum, leave the vents open, and take for sterilization. Next off, we have cleaning of instruments by Nurse Paula and Nurse Corinthia. So here we have the 4-bucket system. The first bucket with soapy water, the second bucket with clean water, the third bucket with 0.5% chlorine solution, where you leave the instruments for 15 good minutes, then the last with clean water. So you leave them for 15 minutes to prevent spoiling them, making them blunt, and then you put them in clean water to remove that jig. Then after that, you proceed to take them for drying. You make sure you dry them in an open space or by air, or you take them to an autoclave. Yes. So after, make sure you are in a protective PPE, personal protective equipment. We can see the apron with 2 pairs of gloves, the clean gloves and those heavy duty gloves, the face mask, the shield, the hair cap. This is all to protect yourself from the body fluids and blood. All of this on these instruments. Remember, we have to protect ourselves. So after you take these instruments to be dried in the autoclave or air drying, then after that you put them in that surgical drum like you are seeing it there. Cover it and expose the vents to show that those instruments have been cleaned and are awaiting sterilization. Thank you. Next we have Jack Ian here taking us through waste disposal. So we have different bins: a black bin for the general waste, all the rubbish, polythene, plastic bags, anything patient's rubbish, you put it there. Then next we have the pharmaceutical bin. That's a gray bin. You put all the expired drugs, the vials, spilled medication, everything concerning pharmaceuticals. Then the sharps container is for all the sharp instruments. You immediately dispose of no recapping needles. Then we have the red bin for highly infectious waste and infectious waste. Everything that used to go in the yellow now goes in the red bin. Those are the things that have blood and then exposed to body fluid. Then remember to dispose of at the point of generation. Marvel on the voice, Shivan on the edits, and praise on the camera. Thank you so much for watching.